today. Whether you're in your 20s, 30s, 40s, or beyond, fertility isn't just a women's issue, it's a man's issue as well. Today, we're diving into what happens to our fertility at every age and sharing new technologies that can assist.
Board-certified reproductive endocrinologist and author of The Lucky Egg, Dr. Lucky? Sekhorn is here to break it all down for us. Welcome, doctor.
Thank you for having me.
That is a perfect name.
I think it works well.
It does.
All right, so fertility by age. Let's talk about what happens to women in their 20s, 30s, and 40s.
Yes. This is an annoying fact, but it's the truth. We have a biological clock. We as women are born with all the eggs we're ever going to have. We don't make new eggs, and we can't fix the eggs that we have. And over time, there's wear and tear, right? And people don't realize that when you're ovulating each month, that's your shot at getting pregnant. You're only ovulating one egg, and it is very much like a lottery, which is why I called my book The Lucky Egg, because it's random. Our body doesn't know how to choose the best egg. And as we get older, there's a statistically higher chance of ovulating an unhealthy egg. And usually that results in an embryo that doesn't implant, or it implants for an initial phase and then stops growing. That's the #1 cause of miscarriage. So as we age, many more of our ovulations involve an abnormal egg. And so it can take longer to get pregnant, and there are higher risks of miscarriage.
Those are real scary statistics, but true statistics. And you said it's let's just tell the truth. So we often talk about women. Let's talk about male reproduction and what goes into fertility problems, because they suffer fertility problems as well, correct?
Absolutely, and this needs to be emphasized more. 50% of couples with infertility have a male factor, but often I think that people look at men as being invincible when it comes to fertility, because they do make new sperm for the rest of their lives. Every 74 days, new sperm cells are created. And they're not carrying the pregnancy. So I think a lot of the focus has been shifted onto women, when in reality, they can have low sperm count. They can have problems with the sperm not swimming to the egg. And these are things, thankfully, that can often be treated successfully. But there can be severe cases that involve the need for a urologist.
What's a good age for men to stop checking their fertility levels?
That's a great question. I think if there's any sort of concern, like someone is a cancer survivor, they went through chemotherapy, they had surgery, any concerns like that, it's never too early to have a check-in. Usually the guidance is you're going to do tests like fertility testing, like a semen analysis, if you're in a situation where you're trying to get pregnant and it's not happening. And the guidance is usually if you're under 35 on the female side, the couple should both be evaluated concurrently after 1 year of trying. Over 35, don't wait longer than 6 months.
Oh, wow. Over 35. Okay. Are there some things that people can do, within their lifestyle, depending on their age, that can increase their fertility or ability to get pregnant?
Absolutely. I wouldn't say that it's the narrative that we see on social media of take this supplement or follow this formula and you're going to revamp your fertility and your egg quality and reverse the biological clock. But there is something to be said about lifestyle, right? And we know that smoking, excessive drinking, these are bad for both male and female fertility.
Tighty-whities.
Exactly. So
is that real?
For sperm,
really?
Temperature regulation is very important.
Oh.
And so extreme temperatures like regular persistent sauna use for an hour a day, every day.
That is not a fallacy, that is a fact.
Wow.
It is.
Wow.
But I always say don't panic. You can always get a checkup. It's a very cheap, relatively easy, non-invasive test to do a semen analysis. So if you have any concerns or you have known risk factors, it's never too early to get tested.
I always keep a very small fan with me at all times. We have a lot of friends that are going through the egg freezing process. And people that are curious about it, what exactly is it, and what exactly is the Like, it could be a little scary for people, I think, when they don't know what it is. Yeah. What is the brief kind of understanding of what it is?
Of course. So fertility preservation is this concept of trying to work around the biological clock. We know you only ovulate one egg each cycle, but there's actually a bunch of other eggs that tend to be available. And we as fertility doctors know how to access them. And if we can remove a bunch of eggs from one given snapshot in time at an age where the quality is better than what it will be in 5 to 10 years from now, and we know that by freezing them, they're not changing over time. And a very uplifting fact, the uterus doesn't really age, right? So it's a very convenient way to try to get around the biological clock. But here's the thing, it's not a perfect solution because human reproduction is inefficient. Everyone at any age can have abnormal eggs. And so we can't assume that every egg you freeze is going to become a baby because that's not how human reproduction works. So it's all about having enough and understanding your numbers and your odds of success, your statistics based on your age.
Okay. Holy smokes, that is a whole lot. Can we talk about what's new in fertility and AI? Because To me, I thought this was going to be the last frontier.
Yeah.
But maybe it's not. I don't know. You tell us.
Yeah, it's so interesting. There was actually a recent AI-assisted tool that gained FDA approval.
Okay.
It's called Embryo Assist, and I actually think that this is ingenious because a lot of people don't realize what goes into IVF treatment. IVF is taking eggs out of the body, putting sperm and eggs together, and growing them into embryos. And we can actually assess embryo quality in different ways. We can do genetic testing, but we can also look at the embryo under the microscope. And we have embryologists. These are highly specialized individuals in the lab that can assign grades to the embryo, and it helps us to select the best embryo that has the best chance of implantation, the lower risk of miscarriage. But there isn't a lot of standardization across the board. So there was a recent study, a fairly large trial, that showed similar outcomes when this AI-assisted tool was used to select the embryo versus just the conventional way with the embryologist. And I think there's a lot of subjectivity, and some programs are smaller, and maybe they don't have all of the data to really understand how to rank the embryos. So I think being able to have all of this data power this type of a tool, it's going to improve outcomes and access for patients.
This is what I'm for, AI.
Wow.
Yes.
Asking for a friend, can you freeze sperm?
Of course, yes, you can freeze sperm. It's especially important for any male who is facing a cancer diagnosis because chemotherapy, surgery, radiation, all of that can have an irreversible effect on the ability to make new sperm. So while we know the average male can continue to make sperm for the rest of their life, if there are certain medical issues or medications or surgeries, that can limit that ability.
This is fascinating and incredibly informative. Thank you so much.
Thank you for having me.
We appreciate it. Oh, make sure you at home pick up a copy of The Lucky Egg wherever books are sold.